You're listening to the Dispassionate ADF Veteran's Voice. Each episode is generated and narrated using artificial intelligence, specifically Google's Notebook LM, drawing from official records like the Royal Commission Final Report, government strategies, inquiry reports, and lived experience accounts. The narration is delivered in American accents, as that is all that is available in this emerging AI tool. Don't let that distract you. This isn't the voice of any one veteran or organisation. It's Australia's veterans' story, told through evidence, not opinion. Here are your hosts.
Welcome back to the deep dive. Today we're tackling something really complex, something under immense strain, the veteran ecosystem. Specifically, that critical, often life-changing moment, the transition from military to civilian life. You know, for so many, it's not just about finding a new job. It's way bigger than that. It hits identity, family, just overall well-being. Okay, let's unpack this a bit. Our mission today is to sift through all this data, reports, studies, reviews, and really pinpoint what seems to be the most essential ingredient for a successful transition. And that seems to be shared, lived experience. We're going to explore why these community-led peer support networks might just be the crucial support that, well, sometimes institutional help struggles to provide effectively.
Right. And we've synthesized quite a stack of sources for you. A lot of this draws heavily from Australian government reviews, those really crucial suicide monitoring reports from the AAIHW, the Australian Institute of Health and Welfare, and also quite a bit of academic research looking into veteran mental health strategies. The consistent message, really, across all of these, it points towards a fundamental shift. We have to move towards a care system that's built on compassion, connection, and is genuinely accessible.
And here's maybe the interesting twist for you listening in. We often look to the big agencies, don't we? Like the Department of Veterans Affairs, DVA, assuming they hold all the answers. But what the research suggests, perhaps surprisingly, is that the most powerful interventions, they seem to be intensely local. It looks like the real, potentially life-saving change is actually being driven by peers. People who've walked that path themselves, turning their own struggles into a kind of collective expertise.
Before we jump into solutions, though, we really need to grasp the profound seriousness of the challenge right now. The stakes are incredibly high. If you look at the hard data, ex-serving men and women have a significantly higher rate of suicide compared to the general Australian population.
That's sobering stuff. It's tough to hear, but vital to understand the scale of this crisis.
Absolutely. And the data reveals something particularly concerning for women who've served. The suicide rate for ex-serving females, it was reported as 107% higher than the general Australian female population. That's based on analysis from 1997 through to 2021. So this isn't just, a mental health challenge in isolation. It really points to a systemic issue in supporting this specific group through a really wrenching transition.
Wow. That one statistic, it really should stop us in our tracks. It says so much about the emotional, the cultural toll of leaving the service. Military life, it's all about the collective, isn't it? That absolute sense of fraternity loyalty. So when separation happens, it's just a massive culture shock for many. We saw one source quote the experience so clearly. When you leave the military, you leave behind your social connection, your identity, your profession, and your cultural way of life, all at once.
That loss of identity, it can be catastrophic. We know, generally speaking, strong social connections are a huge protective factor for physical health, for mental well-being. But for veterans, it's like that protective shield is suddenly ripped away. They're often plunged into this very different civilian world focused on individualism, and they can really struggle to replace those deep, loyal bonds that defined their whole existence before. This abrupt loss of identity and support networks, well, it makes them acutely vulnerable to serious mental health risks. Okay, so let's talk about the formal structures. The system's designed to actually prevent this vulnerability. Paradoxically, the sources suggest these systems themselves often become barriers. The whole framework, often called the Veteran Reintegration System, or VRS, is consistently described as complex, incredibly hard to navigate, and just saturated with services that often don't seem connected. It leads to massive confusion, information overload, especially for veterans who are already distressed.
You mentioned DVA earlier, the Department of Veterans Affairs. How does the community actually feel about relying on that central bureaucracy to fix things? Is there confidence there?
Well, the sources point to a really deep skepticism, a significant trust deficit, actually. We saw one finding, quite stark, from agents working within the support system itself. They said, there just isn't much trust at all. There's very limited trust in the government organization. And this isn't just, minor dissatisfaction. It's a deep, corrosive problem where the very processes meant to help seem to make mental health issues worse.
That seems to be the critical feedback, doesn't it?
Yeah.
The bureaucracy itself becomes another stressor. We saw quotes talking about unbelievable legislative red tape. And frankly, horrifying reports of veterans fighting DVA for their entitlements for, well, sometimes 20 years. So the system designed to give support ends up feeling like an adversary, actively adding to the mental distress it's supposed to be alleviating.
And if you connect that to the bigger picture, this lack of trust, it forces families into this absolutely essential role, but often an unsupported one. Families are effectively the informal first responders in almost every case, yet they consistently report feeling unseen and unheard by defense and DVA. They're often left navigating this complex system completely blind without proper communication or direct support.
But the strange thing is, their efforts are incredibly effective despite that lack of support. The sources show family encouragement is just overwhelmingly critical in getting veterans to seek help. One study found 83% of veterans sought assistance after a family member specifically encouraged them. 83%. That's a huge number. But it does raise a serious question, doesn't it? If the government system lacks that fundamental trust and families are doing the heavy lifting, are we maybe just letting the state off the hook a bit? How do we make sure that relying on community doesn't just become, a cost-saving exercise?
Yeah.
Outsourcing clinical responsibility.
That's exactly the right question to ask. And the sources aren't arguing for outsourcing clinical responsibility, not at all. It's more about integrating non-clinical support where the system seems to fail most profoundly. That's connection and trust. Peer support works, it seems, precisely because it bypasses that institutional trust deficit. It addresses the cultural gap almost immediately. These are non-clinical, peer-led approaches, and they're proving effective at decreasing that really profound stigma often associated with reaching out for mental health care.
So it lowers the barrier to entry, basically. It makes it less intimidating.
Exactly. When you take away the formality of, say, a doctor's office or a government claims department, you reduce that initial anxiety. And peer support tends to offer more holistic, strengths-based view. It focuses more on recovery and resilience rather than purely on deficits or illness.
And the core mechanism here, as the reports keep highlighting, is what they call lived expertise. That's more than just sharing a similar background, right?
Oh, much more. Providers really stress this. The lived experience of the program facilitators, and often the participants too, had a measurably higher impact than just, say, having demographic knowledge. It's about cultural fluency. Think about it. Imagine a veteran struggling with intense isolation. They could talk to a highly trained clinical psychologist who might approach it from a medical framework. Or that same veteran could speak to a peer who says, "Yeah, I remember sitting in my truck for 3 weeks after I got out because I just didn't know how to talk to my own kids anymore." That instant, non-judgmental recognition, that's the therapeutic tool right there.
Yeah, that shared understanding. It just cuts through potentially years of distrust almost instantly.
It really does. And that's why this need for a decentralized approach is so critical. The sources strongly recommend growing a dedicated suicide prevention peer workforce. This ensures support is readily available outside those traditional formal settings like hospitals or emergency departments. They call these benign points of entry to support, places where people feel safer starting that conversation.
And is there solid evidence this approach is actually working?
Absolutely. The peer worker model shows, and I'm quoting here, great promise, especially in supporting veterans with complex mental health needs after they leave intensive clinical settings. It's vital follow-up. And crucially, this isn't some fringe idea. The Commonwealth government actively supports the concept of integrating this peer workforce into the wider support system.
We also saw the importance of cultural specificity mentioned in the reports. You touched on how general civilian models sometimes don't fit.
That's a really key finding. For specific communities, sometimes marginalized ones, the report cited input from Australian South Sea Islander representatives in northern Queensland as an example. For them, services have to fundamentally change their approach. They emphasize that trust is built slowly, through relationship building. Services need to start where people feel safe, in familiar community spots, rather than expecting people to show up at unfamiliar, maybe intimidating official buildings.
Right, that shift from "you must come to us" to "we'll meet you where you are comfortable." That seems to lead us quite naturally to this idea of place-based approaches. Could you explain for our listener what that means in practical terms?
Sure. A place-based approach is really designed specifically to tackle complex, often overlapping local factors, things like poverty, or regional remoteness, or unique local demographics. It works by leveraging the expertise of local people and focusing everyone on shared outcomes. So think of it like this. Instead of a veteran in a remote town having to call a central DVA office hundreds of miles away, a successful place-based initiative might mean the local ex-service organization, the ESO, is empowered and funded to run services tailored specifically for, say, the needs of that regional farming community. It complements government services, doesn't replace them entirely, but it works where those centralized levers are maybe less effective.
And the research seems to highlight veteran and family hubs as the sort of physical embodiment of this idea. These hubs are where that peer-led support can really happen.
Precisely. These hubs, particularly when they're led by or heavily involved peers with that lived experience, they're seen as incredibly promising investments. They build those essential trust systems, that social connectedness that veterans and families are clearly missing. They become that physical safe space where peer support can actually flourish.
So how does DVA, the big institution, interact with these local ESOs then? Because historically, that relationship hasn't always been smooth.
Well, the sources see a massive opportunity here.
Sure.
DVA needs to leverage these ESOs, which are already embedded in communities, right? Not just treat them as external advocacy groups, but actually formally commission services directly from them to be delivered in these hubs. This would formalize the strength that already exists in the community network and give those ESOs the funding and the clear mandate they need.
So the future-focused approach really requires DVA to maybe step back from trying to be the sole provider and instead act more like a steward or an advocate, maybe ensuring quality, navigating, rather than delivering all the direct personal support themselves.
Correct. That seems to be the ideal model emerging from the research. It involves DVA partnering actively with local non-government organizations, NGOs, ESOs, and crucially, co-designing the support with them and with the community. That's how you ensure the services provided are genuinely tailored and representative of the unique, specific needs faced by veterans and their families in that particular local area.
Okay, so let's try and pull this all together. What's the main takeaway here? It seems like we're seeing a massive potential shift in veteran support, moving away from a purely rigid, entitlement-based model, focused just on what you're technically owed, towards a much more needs-based model focused on long-term, lifetime well-being. And in this model, community and peer networks aren't just add-ons. They're recognized as critical, essential agents needed to fill the gaps left by institutional shortcomings, especially that deep trust deficit.
And specifically for effective suicide prevention, this localized approach, it seems non-negotiable. The effective strategies really rely heavily on improving governance, yes, but also strengthening that approach to place-based and community-led initiatives. That's how you tailor efforts to local needs, local resources, making support much more readily accessible right there at the community level, hopefully before a crisis even escalates.
It's fascinating. The systems themselves are essentially acknowledging they can't do it effectively alone. So if veterans feel disconnected, if they lack trust in those formal, centralized channels, well, it leaves us with a pretty provocative final thought for you to chew on. If that community connection, that peer support, is the ultimate protective factor against isolation and suicide, to what extent does the future of truly effective veteran support depend almost entirely on the strength and resilience of the local community itself, rather than us relying primarily on government agencies to lead the charge? Something to consider. We'll leave you with that thought.
You've just heard a conversation built and presented entirely by AI from official sources. No speculation, no shortcuts. From Royal Commission findings to lived experience, we're unpacking the veteran ecosystem. If this episode helped you make sense of the system or gave voice to something you've felt but couldn't name, consider subscribing and liking the channel. That way, you'll be notified when the next episode drops. Send a link to a mate if you think they might benefit from synthesizing the massive information too. We'll upload at least one a week, each tackling a major issue with clarity, dignity, and zero spin. There will be 10 main episodes and many more spin-offs. This isn't just a podcast. It's clarity that is easy to consume and will help to mobilize those who really care.